Hello, I'm Sandra Guidry, one of the medical directors for Rural Physicians Group. Welcome. We are very happy that you have chosen to work as a hospitalist within the unique hospitalist model that is Rural Physicians Group. What defines our model's uniqueness is the very point of this video. Hopefully, it will serve as an introduction, a reminder, and an in-the-moment learning tool that outlines the expectations of all RPG hospitalists while serving the patients and families in our partner facilities. As a hospitalist for Rural Physicians Group, you are in a unique position to significantly and positively impact care in the rural communities we serve, while having flexibility in your schedule and hopefully an improved overall quality of life. We specialize in critical access hospitals, many of which have minimal on-site subspecialty support, but we have this available through phone consultations if needed. We utilize our RPG colleagues as well as evidence-based clinical decision support tools such as Interqual or Millman to help us determine what is best for our patients. We act as champions for electronic medical record and computer order entry during the implementation process and as part of the everyday delivery of excellent patient care. Our hospitalist model is unique, and the following foundational elements are the keys to our success. Because we stay on site 24/7, we are available to respond in seconds to a change in a patient's condition. Our continual presence eliminates staff hesitancy to call a physician with questions or concerns. Our 24/7 presence makes us available and accessible to patients, family members, and referring physicians for admits or consultations. Though available 24/7, you certainly may leave the hospital to run errands, grab a bite to eat, or get a breath of fresh air. However, you must be able to return within a short amount of time. Always let the nursing staff know you have left the facility and will be available by phone. Because we carry a local cell phone with us at all times, we are always available to physicians for direct admits or consults, as well as to patients and their families. Our dedicated cell phone number is available to every patient in every facility. We are also available to the patients and families for up to a week after discharge prior to seeing their primary care physician. As a result of this practice, we have shown a decrease in patient readmissions and an increase in patient satisfaction scores, which is another key driver of our success. Because of our 7 to 10 day shift length, we have realized an increased continuity of care and limited handoffs. In most cases, the same RPG hospitalist will admit and discharge 95% of patients in their care. This RPG practice has been noted within the facility surveys by the Joint Commission as a best practice in patient safety. Focusing on the patient experience is another foundational element of our RPG model. The HCAHPS questions define the patient's expectations of patient care delivery. They are foundational to our model and expected of all RPG hospitalists. We sit down at the bedside with the patient. We check on our patients multiple times during the day. We collaborate on the care of patients with nursing staff and ancillary services as a unified team. We knock on patients' doors, ask permission to enter, introduce ourselves to patients and family members. We listen to patients and always maintain eye contact. We treat the patients we serve as people, deserving of excellent patient care. Collaboration is another foundational element of our hospitalist model. Collaboration with nursing staff is demonstrated in the development of care protocols. Real-time training for both the day and night shifts help nurses feel comfortable in keeping the higher acuity patients within their community. Collaboration with the emergency department is demonstrated by our willingness to physically go to the emergency room and see how we can assist with the patient admission process, especially the higher acuity patients, facilitating a more efficient and timely admission. By being active participants in the observation versus admission process, we demonstrate an interactive involvement with the emergency department. Collaboration with surgeons is demonstrated by our willingness to assist with admissions, consulting the surgeon, providing history and physicals and discharge summaries, while assisting with the medical care of the surgical patient. Collaboration with our community physicians is demonstrated through the relationships we are able to build. In our open model, community physicians may choose to admit and follow their own patients. Our willingness to assume care of their patient at their request for a 24-hour block of time, as well as our willingness to provide coverage for special occasions, such as an anniversary or birthday dinner, is a common courtesy that is essential for a good working relationship. We communicate with local physicians on the admits and discharges of their patients, utilizing their communication preferences as specified. We embrace direct admits, understanding that the workups can be done during the admission process. Not all patients need to be filtered through the emergency room. Participation in medicine committees demonstrates our willingness to be a part of the medical staff of the hospital and is required of all RPG hospitalists while on shift. Some hospitals may require additional services such as reading pulmonary function tests, performing stress tests, and oversight of the infusion center, cardiac rehab, or other supportive services. Ongoing education and refresher courses are available and expected for the RPG physician. They are coordinated by RPG's Medical Director, Dr. Tim Hockenberry, and utilize training centers such as the Banner Health Simulation Center in Phoenix, Arizona. In summary, your success as an RPG hospitalist is dependent on your commitment to fully embrace our foundational elements. 24/7 accessibility on site over your 7 to 10 day shift. Utilizing the dedicated hospitalist cell phone. Providing a collaborative working presence with the emergency department. Collaboration and relationship building with community physicians, surgeons, nursing staff, and ancillary personnel. Willingness to provide additional hospital services as needed. Being the EMR and CPOE champion for the facility. And most importantly, delivering an exceptional patient care experience. Facility-specific onboarding information is located on the facility tabs within this physician portal. If you have further questions, do not hesitate to call me, Dr. Sandra Guidry, Medical Director, Dr. Tim Hockenberry, Medical Director, or Dr. Suk Panu, CMO. Our contact information is also available within this portal and programmed into your hospitalist's cell phone. We welcome you and know you will embrace this unique model and the opportunity to positively impact patient care in the rural communities served by Rural Physicians Group.